Hello everyone. Here you're seeing three periapical radiographs that are taken in the anterior mandible. Tooth number 22 through tooth number 27 is what you're seeing. And if you could pay close attention to the mandibular central incisor projection, you are going to see two diffuse radiopacities that are located along the border of the radiograph. And if you look over to your left or the patient's left, it's not as clear, but you can see there's a diffuse radiopacity here. Also, looking to the patient's right side, this opacity is seen here, but again, not as clear in terms of its border. If you look below, these are some other radiographs that were taken but not ended up being mounted, but you can see again the opacities that I previously addressed. So the question is, just based on this, what do you think these opacities represent? I think if you can recognize the location, I think you have a very good chance of answering them correctly. How about I show you panoramic radiograph? Okay. What do you think? Does it help you? Does it not? In my opinion, the finding is so subtle that I don't really see these opacities on panoramic radiograph very well. Yes, I guess you can claim this area is opaque, but this whole area is blurry in general. Additionally, I see two separate radio opacities along the root of number 27 and another opacity in the area of missing molar. So we're going to look at that later in the separate video. But for this video, try to determine what those two opacities represent. If you haven't been able to answer it by now, I'm going to show you CBCT scan, which should be very clear to all of us. So this is the CBCT scan of the patient, and let's take a look at along the axial view. Again, we can recognize these two canines, and if you remember, the opacities were located along the area of canine. Going through the axial planes, I hope you can recognize that there's a thickening of cortical plate or cortical bone density lingual to these canines. Looking at the coronal section, you can see this exophytic extension or growth of the cortical bone bilaterally. And finally, if you look in the sagittal view, we can see that opacity once again. This opacity is continuous with the remaining lingual cortex of the mandible and demonstrates the same bone density. So this is in the area of number 27, and if I scroll over to number 22, here we see it again. I think what's gonna definitely give away is this 3D rendering view. Look over here, that's the area that we identified. So what are these? These are mandibular tori. And I think you'll have no problem diagnosing this clinically, but sometimes if you look at periapical radiograph, the findings are rather subtle and may not show up very well on panoramic radiograph. But let's head back to our periapical radiograph and we can see them. Okay. And from my experience, these questions often show up on board radiographs or board questions, so I strongly encourage everyone to be familiar with the appearance of mandibular tori. Thank you very much for your attention, and I'll see you in the next video.